All right, everybody. It is 4 p.m. on Tuesday. This is the last time we'll get together live this week to remember that we're going to get through this and we're going to get through it together, even as the next several months may be really hard. As we have shown you, we are now in exponential growth in our cases here in the Commonwealth. And just look at this last week versus the week before. The week before shattering the previous record, and then more than 4,000 additional cases right after that. This is what we are seeing all over the country. But again, we are not going to wait until it's too late to act. The big concern here, well, there's lots of concerns. There's people's health. There is the long haulers, where Dr. Fauci says up to 20% of people may have long-term complications from this. There's certainly the people that we lose. And the number of people that we lose is compounded when community spread is as high as it is, both when it gets into vulnerable populations like our long-term care facilities, but also when it overwhelms the healthcare capacity of a state or a region. Now, this is happening in real time across the country. We have shown you different clippings, different news about different areas in the country that are having their healthcare capacity truly tested. And there are even more today. I'll start with Pennsylvania. They're concerned by the middle of next week that the state will run out of ICU beds based on the growth that they are experiencing. This is exactly what we do not want to happen here in Kentucky. You look at Arizona, which just in the summer went through one of the worst outbreaks we'd seen with severe loss of life, are already seeing their hospitals filling up again, concerned that their healthcare capacity would be overwhelmed for the second time since they've been facing this virus. But it's also starting to happen here in Kentucky. What we are seeing is different hospital systems being very responsible, but taking steps right now because they see the trend. The fact that we have more and more people in the hospital with COVID every single day. This is UK, closing 5 operating rooms to free up resources for COVID-19 patients. This is right in our backyard. There's an entire group of hospitals around the state that we're talking here to Lex 18 about their concerns and how quickly capacity can be eaten up. There's Med Center, the COVID unit at TJ Sampson. The Med Center COVID unit and TJ Sampson, both seeing increased cases and increased need for ICUs happening really quickly. Southern Kentucky hospitals dealing with COVID-19 cases. This Daniels Ephraim McDowell has a COVID-19 unit that is full. Those are the things that we don't want to see. And then this one we showed before. It is from Northern Kentucky and the stress and the strain that they are seeing on their healthcare capacity there. All across this state, we are seeing beds fill up. We are seeing nurses and doctors stretched. And if we do not stop the exponential growth of cases, we will exceed our healthcare capacity. We will run out of doctors and nurses that are not sick or are not quarantined. And we will experience more loss and more death than we have to. And so it's up to all of us to protect one another, to do the steps that it takes to cut down on cases. And one of those is being careful this Thanksgiving. So we're having a rush on testing right now across Kentucky. And while we want more people getting tested, and we believe that it is people who are getting tested, and if they test negative, they then think they can have a big Thanksgiving. I hope that's not the case out there. Time just did a story about how a single COVID-19 test can't guarantee a safe Thanksgiving, and it can't, because it can take time for an infection to show, and real concerns that that folks will engage in activity that we know could create super spreader events in every community across Kentucky based on one of these tests. So please keep your Thanksgiving celebration as small as you can. That'll make sure that your extended family are around to celebrate Christmas and to celebrate the holidays next year. And just in the last couple days, numerous friends losing family members, people close to them. I don't want that to happen to others across Kentucky. So let's do what it takes. Travel advisory shows how bad things are getting across the United States. I think these are more states than we have had on this ever before. Notice Ohio is now on here. And the rates here just show you how hot the virus is right now. And just to further expound on that, I was looking at some of the numbers reported from other states today. Indiana, 103 deaths just today. Wisconsin, 104 COVID deaths just today. Ohio, 98 COVID deaths just today. Let's never, ever get to triple digit deaths here in Kentucky. You know what? Let's make sure we never hit those 30 number again. Though we have a lot of them that our people are looking at right now. Our committee that reviews them, and next several days are probably going to be tough on those numbers. Our case numbers today show that we still have a lot of work to do. Today is our second highest Tuesday. That's just after last Tuesday. And is our ninth highest day with 2,690 new cases of the coronavirus. Brings our total cases to 162,838. We're announcing 17 new deaths today, bringing our total loss to 1,809 Kentuckians who we will miss. New cases by county: Jefferson, 394, Fayette, 201, Hardin, 118, Madison, 80, Davis, 73, McCracken, 72, Boone, 71, Warren, 70, Boyd, 65, Nelson, 54, Pike, 49, Kenton, 45, Graves, 43, Oldham, 39, Hopkins, 38, Bullitt, 34, Jessamine, 34, Laurel and Pulaski, 34, Montgomery, 33, Henderson and Shelby, 32, Marion, 31. All the others can be found at kycovid19.ky.gov. Our positivity rate today at 8.82%, still far, far too high. We have 1,658 Kentuckians in the hospital. That's up 85 since yesterday. 85 more people hospitalized for COVID-19 since yesterday. The last 2 weeks, it's up 469 Kentuckians. We have 390 Kentuckians in the ICU. We have 207 fighting for their life on a ventilator. 17 families today grieving the loss of a loved one. And I hope we're there for them. And I hope that we will continue to light our homes and our businesses up green. We'll continue to ring our bells at 10 a.m. every morning. And I hope that we will provide support to them in their community and however they choose to communicate about their grief. I just want to mention that when somebody shares their loss, whether it's on social media or elsewhere, don't attack them. Don't attack them. What does it say about someone's values or faith that at someone's worst moment, they try to kick them or attack them? Our goal as good human beings is supposed to be about being there for one another, especially at our lowest, most difficult times. So please support these families. If you have other grievances, you can get on my social media and put them there, but support these families. Today's deaths include a 90-year-old woman from Callaway County, 3 individuals from Davis County, an 81-year-old woman, a 52-year-old man, and a 64-year-old woman. An 81-year-old man from Hardin County, a 67-year-old man from Henry County, an 86-year-old woman, 64-year-old man, 88-year-old man, 67-year-old man, 75-year-old man, and 76-year-old man, all from Jefferson County. We have a 78-year-old woman from Kenton County, a 60-year-old man from Martin County, a 90-year-old woman from McLean County, an 88-year-old woman from Metcalfe County, and an 81-year-old woman from Shelby County. Long-term care continues to be overwhelmed by the community spread. We have some of the best defenses in place, but if we can't get our communities doing what it takes to lessen the spread that's out there, we cannot keep it out of these facilities and protect your loved ones. 92 new residents testing positive, 115 staff, 18 new deaths attributable to long-term care facilities. And this one hurts every time. We've lost another one of our veterans from the Thompson Hood Veterans Center in Wilmore. That is 28 deaths of our veterans who fought for us, and we failed them. Now, the facility has gone 10 days without a new positive case with a veteran, and none of our other centers have any positive cases. Remember, this is a facility that we kept COVID out of until the middle of October, until we saw this exponential growth. And it's taken 28 individuals who we should have been honoring by wearing masks and working as hard as we can every day to help protect them and those around us. It's hard, and we need to do better. And we need to make sure the way we celebrate this Thanksgiving and the way we go about the next 3 weeks is done in a way to where this doesn't happen at our other veteran centers, our other nursing homes, or anywhere else across Kentucky. We have a duty to one another. And I think the Pope even said today, and obviously this is in my words, refusing to wear a mask doesn't make you a tough guy and doesn't mean that you're pushing back against government going too far. Wearing a mask just means that you care enough about other people to protect them from a deadly virus. That's all. So please, everybody out there, do your part. We're going to open it up for questions, moving quickly today. We got a number of journalists on the line, and then I have, I think, 2 written questions, and then we have a closing message today from somebody on the front lines. So we'll start with Shelby Lofton from WKYT.
Looks like she was unable to join us, sir.
Okay, then we'll go to Catherine Collins at WLEX.
Hi, Governor. Yesterday, you mentioned that you hope to not have to extend these new restrictions past December 13th. Can you talk about what you'd like to see specifically by that point that would show you it's okay to lift those restrictions?
We want to see, in the very least, a slowing of the growth. You know, we talk about COVID right now being a fast-moving train, and you got to slow it down before you can stop it, and you got to stop it before you can turn it around. We ought to be able to see in the data, especially in that third week, that if you look at that stair-stepper chart, that in the very least, the increase isn't as severe, if not a plateauing, which we were able to do in the first 2 waves. If we can achieve that, then we just need better compliance as we go back to doing some of those things that we were previously able to do. I mean, we proved that if you enforce the mask mandate at retail, at restaurants, and at others, then we can have a serious and significant impact in even stopping the increase in cases. We've just got to get back to that. But this pause in certain activities that we're going through right now is absolutely necessary. Many other states are doing it. to stop what is exponential growth. I want to make sure that we are never a Florida, Texas, Arizona, New York, where their loss of life has been absolutely tragic. James Pilcher from WKRC Local 12.
Good afternoon, Governor. A two-part question. First, the several restaurants in our area have complained that some are being allowed to stay open and some are having to close, that there's been inconsistent guidance or regulation on what constitutes outdoor dining. If you could address that. And secondly, can you talk about the escalation of enforcement in general when it comes to this restaurant issue? There are several restaurants saying it's going to take a court order or even more to get them to close. And what steps are you willing to take in terms of enforcement to take it to that next level?
Well, James, they have an order. It's from the Supreme Court that says we have the authority to do this. Staying open right now for indoor dining is a violation of the rule of law. It's to say, if I don't like the law and I don't like how it's being applied to me, I just won't follow it no matter what. Our society can't move forward with people who openly violate the law if they don't like it. Once the Kentucky Supreme Court has ruled, that's supposed to be it. Restaurants that are still open for indoor dining are losing their food permits. They will lose their alcohol beverage, their liquor licenses. And that's going to be a process that lasts longer than 3 weeks if they have to apply to get them back. But we know it's spreading in these establishments. And by staying open, first of all, you're not doing your part to stop the virus. And second, there will be enforcement actions out there. We are working through the issues related to outdoor dining. There are just so many different things that people are trying, and we want to make sure that we work with these facilities as long as what they put up doesn't create an indoor dining experience or an indoor dining threat that we see right now with COVID. But it's taking us going through the different ones that are set up, and we are trying to be consistent in the way the enforcement is. There's just a lot of different options that we are seeing out there, and we don't want to just blanketly say no to tents, for instance. We want to review the options, to let people know what we think can be safe, so that they can again have as much business during this period of time as possible. Got a question here about requests for the comments about the newest federal lawsuit. It's ridiculous. Nobody is saying that a family of 10 can't continue to live together and to eat together. What we're saying is, if one family wants to have another family over, it's only 2 households, 2 groups that live under the same roof, and 8 people total in that group. To suggest we were saying you can't have dinner with a large family is ridiculous. And I know that there are some attorneys out there that just itch for fights or want to make the news, but it's dumb, and we don't need to be having these types of distractions with what we're trying to do to save lives. And that's what we're doing. We are saving lives. Those that frustrate our attempts to save lives cost people their lives. And seeing your name in a newspaper isn't worth somebody losing their mom or dad or their brother or their sister. All right, Tom Latek, Kentucky Today.
Good afternoon, Governor, and happy Thanksgiving to you if this is going to be your last one this week. Historic racing facilities are not part of these new restrictions. Now, they're already on borrowed time because of the Kentucky Supreme Court ruling. Why not include those? And my second half is, how's our PPE supply doing?
So historic horse racing facilities are included. They're at 33% under this without being able to serve food and beverage inside. We clarified that with them earlier this week, and so they are included. PPE, our stock is generally in good shape, though we still need more N95 masks, and those are still incredibly hard to get, so we continue to work to purchase those. We will hear from time to time about a facility that people claim doesn't have enough PPE. We call them, and typically either they do, and there's a misunderstanding, or there's an argument amongst staff and management about how they're deploying that PPE. And we work through that with those facilities because we want everybody to be safe. Nationwide, we see different fits and starts of concerns about PPE. Right now, we are not seeing the type of constriction or concern with most types of PPE, but the N95 mask being the exception that is still far too hard to get. Connie Boyer from WEKU.
Hi, Governor. Thanks for taking my question. As more healthcare workers get sick and have to quarantine, and hospitals have to pay higher rates to hire nurses from staffing agencies, how will Kentucky be able to compete with other states that can afford to pay more for healthcare workers? And then, are there any Kentucky hospitals in danger of temporarily shutting down if they reach capacity and if they don't have enough staff to care for patients?
Let me start with the second part of that. Right now, we see hospitals already taking steps. U of L has ceased a number of elective surgeries and procedures, and we see that in other parts of the state too. We see UK closing down operating rooms to have more space for COVID patients. U of L is announcing it's opening a floor of the hospital that hasn't been open for 12 years to accommodate COVID patients. But you're right in that it's ultimately going to come down to the stress and the strain on staff. We're working with our hospital systems on a daily and a weekly basis. We'll work to address their needs if they bring that to us. Certainly, there have been some positives that have happened during this. The federal government increasing the share of Medicaid that they pay, and some other direct help that they provided to hospital systems has been helpful. But on staffing, we got to know that whether it's us or another state, we got to solve this problem ourselves by reducing the number of cases. There is not help coming in the form of additional healthcare workers from other states. Everybody's getting hit at the same time. And the answer to all of it is lessening the number of cases. Melissa Patrick from Kentucky Health News.
Hi, Governor. A report out of Milwaukee said their health department workers are facing death threats and doxing because of their enforcement of the state's coronavirus orders. Can you give us an idea of how much of this is going on in Kentucky?
It's going on every day in every local health department to every single worker. It is awful and it is disgusting. Our local health department workers are scared. They're scared to release their local numbers. They're scared to do basic enforcement. They're people's neighbors, fighting for the lives of neighbors, and people treating them this way is unacceptable. It is not in accordance to our values. It's not in accordance to my faith. It is not Christian. I just had a story told to me about somebody's 75-year-old aunt at a grocery store being yelled at because she was wearing a mask and even pushed. Yeah, that makes that guy real tough, doesn't it? Don't be a jerk. Grace Schneider from the Courier-Journal.
Thank you, Governor. Good afternoon. I wanted to ask about the Kentucky State Police that is said to be investigating a police-involved shooting in the west end of Louisville from Sunday night. We understand there's body cam video, and we wonder why it hasn't been released.
My understanding, in being briefed today, is it is going to be released. There is one or two steps that they hope to accomplish over the next day or so that need to be done before that release. But I have a full expectation that it will be released to the public. Catherine Collins from WLEX. We'll go through one more time.
Sure. One of the hospital leaders I spoke to yesterday talked about how much of the burden of the pandemic has fallen on nurses, and they're
Yeah.
seeing a lot of turnover because of that. Is the state considering any programs or assistance to make sure nurses are supported right now?
I know that we have made some changes in long-term care and maybe some other settings about who else can step in and help when there are shortages. We'll get Secretary Freelander to talk about that next week. But we'd certainly talk with our hospitals about any additional steps that they think we need to take. Certainly, when we looked at law enforcement and we were seeing significant numbers quarantined, we allowed those that had retired, within the last year or so to be able to come back and help. That's certainly something that we could look at. Let me say to our nurses, thank you. Man, I can't imagine what you go through every day. I was watching a healthcare provider this morning on the news, I think from Minneapolis, just crying, inconsolable after losing 3 people the day before. I can't imagine the emotional pain they're going through. I can't imagine the frustration after seeing people die, after fighting to save their lives, when you stop on the way home to get gas if nobody's wearing masks. I can't imagine what that must feel like. So for those people whose help you might need, whether it's COVID or not, if you don't believe in COVID, you may need a nurse for a surgery or if you get something else. So please, for them, do your part. James Pilcher.
Thank you, Governor. Following up on my question from yesterday, can we get some more specificity around the numbers for Northern Kentucky in terms of healthcare capacity? Well, as you know, St. E's is a private organization, so sometimes it's hard to get that data out of them. So I didn't know if you had anything specific you had on hand, or you could have our staff send us. We're trying to get our arms around what the capacity is and what the situation is as a surge happens in Northern Kentucky. Thank you.
I don't have it, James. I don't have it in front of me. We will see what information that we have and send it to you. I know St. Elizabeth is engaging in steps where they're looking at their healthcare capacity, where they're looking at what other things can wait with the influx of COVID patients. They are being proactive. All of our hospital systems have. They've been amazing during this. St. Elizabeth's included. Tom Latek, and happy Thanksgiving to you as well.
All right, Anna, thank you. With the issues that we're facing with the hospitals around Kentucky, is the field hospital at the state fairgrounds, is work progressing to get that back in a position where they can accept patients?
So we now believe we can set that up in 7 to 10 days. And so we're not there yet. We have a shorter window than before to get it up, but it is there. We've gone through the planning process of how to get it up. We have shortened the amount of time to get it up. And I believe that there are even some in other parts of the state looking at different locations if that community has to set up a field hospital. And it'll be a decision as we watch the data, but remember, we have to staff it too. And so we'll want to make sure that if we set up a field hospital, we're not simply taking practitioners away from other places they would be helping people. And the field hospital itself is for folks that might need hospitalization, but certainly not an ICU bed or a ventilator. It should be for folks that we think we can get stabilized in a shorter amount of time. So it'll take triage to determine who needs to be there once it's set up, if it's set up again. Remember, our decision was that we did all that except for the separators as a state, so we own it. We can use it in other circumstances if we have to in the future, and we can get it up a lot faster. Connie Boyer from WEKU.
Hi, is there any update today on the number of cases in Kentucky prisons?
We'll get you that update early next week. The Lee Adjustment Center continues to be a challenge, and part of how it spread that much in that facility is due to how the facility is set up. But we will get you our most recent numbers. What we see in each of these is we're stable, and then boom, it spreads so fast. And our prisons are in many instances in the same situation as our long-term care facilities. We and our jailers did a really good job of keeping this out for the most part until the community spread was so great that those defenses won't work. If we're having 2,600, 3,000, 4,000 cases a day, it's going to be everywhere that people get together. So again, I know I'm sounding repetitive. We got to take the steps to reduce the cases, and we got to do it now. Melissa Patrick.
Again. So this week's White House report calls for proactive focused testings to identify asymptomatic and pre-symptomatic individuals. Today, the Co-Immunity Project, through their random testing, found that infection rates are 10 times higher than they were 2 months ago, and that those infection rates are nearly 5 times higher than what's being reported by case numbers in the city. So between those two things, do you think it's time, or will there ever be a time, to do random testing across the state to get a truer picture of the spread of the disease?
So the Co-Immunity Project is doing good work. I was sent their report today, and we'll be communicating with them. We have also been doing a study with LabCorp that is giving us data on how widespread that we think the virus is in Kentucky. I'll have Dr. Stack talk about it next week, but it's got some different numbers than the Co-Immunity Project. So, but it's also statewide. So that's something that we'll want to look at and discuss between them. Certainly, there are asymptomatic people that don't get tested because they don't have symptoms, and therefore aren't cases that we report each day. We are seeing more testing though now than ever before. We believe that we are getting a majority, certainly, and I think we're getting the vast majority of people who have COVID ultimately getting a test and or later finding the antibodies. But that's good work that they're doing. It does help to try to give us a clear picture. And what it says is it's a really aggressive virus. I believe that report today talked about just since September, this virus is spreading so much faster than it was before. And that ought to set off the alarms and supports the steps that we're taking. Grace Schneider from the Courier-Journal.
Thank you, Governor. Is there still no centralized system where the state can release contact tracing numbers that show where people are going in the days before they test positive? Or is this left entirely to local departments?
So I want to clarify that the purpose of contact tracing is to stop the virus moving forward. So the information that was focused on when the system was created is who's the individual, who are their close contacts, how do we get in touch with their close contacts as quickly as possible, and how do we then provide them services if they're quarantined and need food assistance or the other. When we created the system, it was not designed to look back, though some of that information is certainly collected. And there wasn't a drop down of click here if it's a restaurant, or click here if it's a gym, or click here if you don't know, or click here. So that information may be collected in longer texts, but that was not the purpose of what contact tracing, at least our system, was designed for. It was for all these hundreds of people that are doing it to be able to share, this person tested positive, I need help to contact these other 80 or 85 people. And as we talk to our local health departments, as their cases picked up, it's all they could do to just call those people and tell them that you need to quarantine. And then it got to the point where they couldn't do that. So that's asking for information that's not sortable. But we have every major federal expert saying restaurants, bars, gyms are places that this spreads. We have multiple studies nationwide done using phone information about where people have been that can provide quantitative evidence on the fact that it's spreading in those locations. We know that when we had to stop indoor dining and close bars, that we stopped the increase in July. We have seen other states that have surges taking these steps, and they worked. So I know that there are some folks that keep saying, show me the data and show me the data, but here's what I believe. There are two types of folks that believe the world is flat. Those that will tell you that they believe the world's flat. There's nothing you're going to be able to tell them to show them that the world's round. Then you have another group that believe the world's flat but don't want to tell you that. They know how it sounds. So they ask for proof that the world is round. And the more proof you give them, the more proof that they ask for. And you're never ultimately going to give them enough because they want to believe that the world is flat. We know how the virus spreads. We know it spreads when you go somewhere, congregate, and take your mask off. And those are the exact type of locations we've had to put these restrictions on. It's not fair to the locations, but it's the virus not being fair to those locations. Okay, final written question. Says the owner of Beans Cafe and Bakery in Dry Ridge has decided not to follow the latest order to eliminate indoor dining. On Monday, the Northern Kentucky Health Department suspended their food permit, but they're still operating. This is the restaurant that lost at the Supreme Court. Folks, if we file the lawsuit and we don't win it, and it goes all the way up to the Supreme Court, and they tell you what the law is, you don't get the choice to ignore it. You don't get the choice to ignore it. And this concept of, and I know it's hard, it's a business, but I can do whatever I want, whenever I want, is not American. It's not Christian. That's not who we are as people, and that's not the society we founded. We founded a commonwealth here where we're all supposed to work for the commonwealth, that everybody has opportunity. And remember, our rights stop where other people's rights start. You can't run in to a movie theater and yell fire. That's not freedom of speech because other people's rights have started and yours can't intrude on theirs. Here, how about all the people out there that don't want to be infected and are trying to do it right? All that we ask is, again, that people follow these rules and restrictions. They're absolutely necessary. They're being done in other states. They're being done in other countries. We are in a tough time, but we have a vaccine that is so close. And I want to make sure as many Kentuckians get there as possible. Folks, I know I sound tired today. I am. We've all been battling this a long, long time. But we're so close to the end. And I can't wait until the end. I cannot wait until we have crushed this virus and we can then safely mourn the people we've lost. And then we can see each other again in the way that we want to. I cannot wait until that day. But until then, we have a responsibility to each other. We have a responsibility to the people of the Commonwealth, to the people of this country, and to the people of the world to try to help keep them safe and not spread the virus to them. So this Thanksgiving, please do it safely. My Thanksgiving is going to be myself, my amazing wife, Brittany, my two wonderful kids, Will and Lila, and the dog, Winnie. That's it. I love Thanksgiving. I love my extended family. But I'm going to take the steps to protect them and to do my part as a Kentuckian to stop this new exponential growth. I hope you all have a wonderful Thanksgiving. Remember, we still have a lot to be thankful for, even in these times. I hope that you are safe these next couple days, please wear a mask. Protects you, protects those around you, keeps you from bringing the virus home. We can do this. We are so, so close. Let's keep it up. Finally, we have a message tonight from one of our frontline workers, Katie Rogers, a nurse practitioner from Norton Healthcare.
I'm Katie Rogers, and I'm a nurse practitioner at Norton Healthcare. Since the beginning of COVID, we have heard about the importance of flattening the curve, but cases continue to rise, and we see this in both the community and in our hospitals. For those of us in healthcare who care about our patients and their families, those that we work with, and the community we serve, this is very concerning. The things we know that help control the spread of the virus, like wearing a mask, social distancing and limiting social interactions, washing your hands, proper sneeze and cough etiquette must continue. We cannot give in to COVID fatigue. It is important to protect our healthcare workers and ensure plenty of staff and beds are available for those who need us, whether it be patients that are suffering with COVID or other critical illnesses. While we hear a lot about person-to-person spread, one very important fact to remember: on average, an infected individual spreads the new coronavirus to more than 3 people. So just one person with the virus who ignores social distancing guidelines can cause a chain reaction. We know this Thanksgiving will be different, and we are grateful to each of you who are doing your part by thinking twice before visiting vulnerable loved ones this holiday. On behalf of everyone at Norton Healthcare, please stay safe, keep the faith, and happy Thanksgiving.